brain MRI, diffusion weighted sequence. Looks like there's some blooming in the right thalamus. No signs of any diffusion restriction. Some amount of altered signal intensity is there in the thalamus. This is the ADC map. TOF cerebral angiogram demonstrating all the main vessels. Everything appears to be patent. No signs of any occlusion. Axial T2 flare shows some T2 flare hyperintensity in the central pons. Extensive white matter bilateral frontal and parietal lobe confluent T2 flare hyperintensity is likely due to chronic small vessel ischemic changes. The lesion appears to be centered in the right thalamus. The gradient echo images, susceptibility weighted imaging shows blooming in the right thalamus. So it's likely to be an acute thalamic hemorrhage because of hypertension. There is seeding of or blood CSF level seen in the dependent portion of bilateral lateral ventricles, more so on the right side, lesser on the left side. These are bilateral globus pallidus calcification, probably a little bit of extension of the bleed into the posterior putamen on the right side. Focal microbleed seen in the right superior parietal cortex. Per se, it doesn't look like there is any obstructive hydrocephalus. More, it's a 90-year-old person, so there's age-related neuroparenchymal atrophy, and as a result, the ventricles, as it is dilated. So this is a case of likely hypertensive bleed. The extensive confluent white matter hyperintensity suggests this is a long-standing hypertensive patient, and expected hemorrhage in the most common site in a hypertensive bleed.